Hello. I am so greatly humbled to receive the John Gilbert Award from the National Association of Community Health Centers. John Gilbert was an amazing figure and a formative partner for us in the early going of community health centers. So that as well makes this very special. I'm well aware that there are hundreds of executives and clinicians and board members who are deserving of such an award, and that so many are never nominated. So I recognize that I represent all of you in this regard, and am again so very humbled to be selected. Patients in vulnerable communities deserve devoted leaders and devoted clinicians. They are the people of greatest need in our country. So what an amazing feeling this gives me. I'm thankful to Affinia Healthcare, my friends and colleagues there, and the Missouri Primary Care Association, and A.T. Still University and its work across the landscape of community health centers, and my many friends across the state of Missouri who, in the healthcare landscape and the academic landscape, have been there to support me personally and my lovely wife, Deanna, and family along the way. And also, most importantly, to be there for patients who deserve our attention, deserve an equitable place for healthcare and healthcare services to be delivered. So again, to the National Association, thank you so very much.
Hello, and thank you for this opportunity to speak with you today as a recipient of the 2023 John Gilbert Award. I am honored and humbled that my colleagues have selected me for this. I would like to thank my family, my friends, my colleagues, and most of all, patients who have been with me along this ride. I'd also like to take an opportunity to talk about why I enjoy working in a community health center. I'm reminded of a time several years ago when Representative Elijah Cummings spoke at a P&I in 2014. And the words he said resounded with me. And he said to us, that you changed the trajectory of people's destinies. We changed the trajectory of people's destinies. This is my why. This is the thing that I get up to do every day. It is so important that our patients come to us. They trust us. They have put their faith in us, and they will continue to do that. We have done this for over 50 years. We've seen 30 million plus patients. We cannot grow weary in doing good because we have reaped a reward, but there is so much more to do. There are, I'm sure, another 30 million patients to see. We've got another 50 years in us. Our patients trust us. They believe in us. They are us. So in the words of McFadden and Whitehead, ain't no stopping us now. We are on the move. So let us be about the move, because my friends, this is who we are, and this is what we do. Thank you. Thank you for the opportunity to live my why.
Working for a community health center is very important and very rewarding. And in my case, as a board member of a community health center, I understand all of the services that we provide in our communities for supporting our communities. You know, healthcare access is very important, and particularly in a rural community as the one that we are fortunate to serve. Health centers are expanding not only just in comprehensive healthcare, but some of our health centers across the country are involved in providing housing, providing transportation, supporting areas that are designated as food deserts. All of these services are what make up health centers today. And it is very important and very rewarding to be associated with that.
Hello, Community Health Center colleagues and believers in the health center movement. It is such an honor to be the 2023 recipient of the Samuel U. Rodgers, MD Achievement Award. I'm so sorry I can't join you all in person this year in San Diego, but am humbled to have stood on the shoulders of early leaders in the community health center movement like Dr. Rodgers. I wanted to become a physician since I was 7 years old, partly because of the general practitioner who was my primary care clinician, who made a home visit to diagnose my chickenpox, stitched up the lacerations from rough and tumble play of a curious and active young boy, and supported my mother with advice and reassurance as a first-time mother of such an energetic child. I became the first in my family to go beyond high school and complete college, medical school, and graduate work. I was drawn early on to the heart and soul of healthcare, which is embodied in the work and spirit of community health centers. The incredible foundational work of early leaders of the movement across the country, like Dr. Rodgers, made it possible for this child of the 60s to have so many opportunities in the 80s after finishing my residency in family medicine in Los Angeles. It is a remarkable privilege to serve so many people and families and communities through CHCs. It's particularly rewarding to receive this recognition this year when Sunrise Community Health, where I serve as Chief Clinical Officer, is celebrating its 50th anniversary. Our work is not yet done. Our mission remains more relevant than ever, and the FQHC movement to make access to quality, affordable care universal remains strong. Muchas gracias y adelante.
I couldn't have imagined when I first interviewed at Yakima Neighborhood Health Services that I would have made a career at a community health center. I was fresh out of college and I had 2 job offers, one at a national pizza chain and the other at a neighborhood clinic. The exam rooms were 2 former bedrooms, the kitchen was the pantry, and the living room was the waiting room. I told my family this looked a lot like the Pete's Corps, but I was pretty sure that there was running water. Between the pizza place and the neighborhood clinic, I took the road less traveled. But 40 years later, the community health centers are the heart of primary care, and I just can't imagine being anywhere else. Community health centers have been called on and proven how much we can be counted on when we stay true to our mission. Reducing barriers, improving the health of our communities, and most importantly, leaving no one behind. Our teams turned parking lots into exam rooms, our mobile units became our calling cards, and we use that to reach out to our most vulnerable populations. We offer help with housing, food, and so many basic needs that have done so since the 60s. Social determinants are part of our DNA. As Dr. Pedrosa, our Chief Medical Officer, often says, it's so humbling to know that the physician is not always the most important member of the team. It's our secret sauce of holistic care that truly makes us patient-centered every day. Thank you for this amazing Louis Garcia Community and Migrant Health Center Award. I'm so honored to be receiving it.
I am very humbled by this recognition and very grateful to NACHC for this honor. Words cannot express how much this award truly means to me. I would not have been able to achieve this recognition without my wonderful family, the credible leaders and teams I've worked with. When I started my career 30 years ago at AAF CPAs with Matt Hutt, working with health centers, I immediately fell in love with the people, the mission, and the history. I've had the honor to work with health centers that mean so much to me as part of the health center movement, from the first in the country at Columbia Point, working alongside Dan Driscoll and Walter Keeley, and able to meet Jack Geiger, then to Edward Kennedy Community Health Center, working alongside with Tony McGuire, and now to Greater Lawrence Family Health Center, working with John Silva, and now with Dr. Guy Fish. I feel blessed that I was able to work alongside so many incredible leaders who are so talented, who engaged, challenged, and inspired me. I learned so very much from them. Thank you for their faith, their support, both professionally and personally, and most of all for their friendships. I will be forever grateful. Thank you to the Mass League and NAB for all the work we have accomplished together for all our health centers, our communities, our patients, and our teams. Thank you to my amazing children, Caitlin and Johnny, my mom and dad, mother-in-law, family, and friends, and most of all, my husband, Bob, who has been my rock since we were 17, and who's always there for me and always supporting me. I couldn't do this without all of you, and I love you so very much. I'd like to end it with a quote from Helen Keller. Alone we can do so little, together we can do so much. Thank you.
Wow, I am so honored to be selected to receive this prestigious award as a health professions education and training recipient. I am grateful to the National Association of Community Health Centers for this recognition. This is an organization that I cherish dearly with colleagues I have so much respect for. So this means a lot. Over the years, I've gotten to be a professional educator as a chief resident, as a health disparities collaborative scholar, as faculty at many different teaching institutions, as a Joint Commission surveyor, and most dearly to me as the chief academic officer of my health center's teaching health center programs. Here I get to be a part of the growth and development of young physicians who are going to go out into the world to make a difference in the lives of the communities we serve. I appreciate this award even more so because I'm aware of the talent and the skill sets of the others who are considered for this award, and it makes me even more special to be recognized. I do appreciate that this can be quite overwhelming sometimes, but I think having teaching as a calling and seeing the difference I get to make in the lives of young physicians keeps me going. And I'm so grateful to have the privilege to do that. I am grateful to my health center CEO, Mr. Hall, and staff for this recommendation or nomination. And I'm super grateful to my wife, Sarah, and my son, Simon, who continue to inspire me and encourage me to do what I do best. Thank you for this recognition, and I appreciate the inspiration and encouragement.